Whether you are well versed in liver lingo, and for those of us who remember A3 in person, we will someday go back to playing liver lingo bingo. We might upgrade from the lifesavers that we used as bingo markers for the very first liver lingo bingo session. And so now we're going to term this, as we've been growing up in our advocacy, becoming liver literate. And to help us with that is Dr. Nehna Abdul Majeed, who is coming to us from the NIDDK, the National Institute for Diabetes, Digestive, and Kidney Diseases, our home institute at NIH, if you will. And I want to thank Dr. Jake Lang, the head of the liver branch, for always lending us their rising star researcher to help lead this session. So all of us, no matter what type of liver disease we originated from or have or live with or understand, that we're all conversant in really fundamentals of liver language. And so I will give us to our speaker. Thank you.
Hi, everyone. Thank you for joining me for this session. I'm Nehna Abdul Majeed. I'm a second-year clinical hepatology fellow at the National Institutes of Health in Bethesda, Maryland. I thank Global Liver for giving me this opportunity. My talk today is titled Becoming Liver Literate. In this talk, we will go over liver disease in general, how liver disease is diagnosed, what to expect during your doctor's visit, life after diagnosis, and what you can do to prevent liver disease. Thank you once again for joining us today. I have no financial disclosures. Let's have a brief overview of liver as an organ. Liver is the largest solid organ in our body. It sits on the right side under the rib cage. If you look at the image on this slide, you can see that the red organ is the liver, and it's right below the right lung and diaphragm and sits in the upper abdomen. Liver plays a major role in separating nutrients and waste as they move through our digestive system. It also involves in metabolism of medications and toxins. It produces bile to carry toxins out of our body and plays a major role in immunoregulation and storage of vitamin A and excess calories. So, what is liver disease? In simple terms, any abnormality of the functions we just discussed can cause liver disease. Then comes the follow-up question, how common is liver disease? To answer this question, I will introduce you all to Michelle. Michelle is like many other patients we see in our liver clinic. She is a 35-year-old woman with 2 daughters who presented to our clinic with abnormal liver enzymes. After a thorough workup, she was diagnosed to have primary sclerosing cholangitis. This highlights how liver disease does not discriminate by age. Everyone, regardless of age, is at risk for liver disease. And chronic liver disease is also the 4th leading cause of death in patients under the age of 50. Now let's look at the global burden of chronic liver disease. Cirrhosis, or end-stage liver disease, is the 11th leading cause of death globally. And it's estimated that there are 1.5 billion cases of chronic liver disease worldwide. And the major causes include viral hepatitis, alcoholic liver disease, and fatty liver disease. The different types of liver disease can be due to these broad categories of viral infections, defective immune system, toxins, excess fat in the liver, inherited or genetic diseases, and cancer. Furthermore, liver disease can be broadly categorized into liver tissue disease and bile duct disease based on what part of the liver is affected. In liver tissue disease, also known as hepatocellular disease medically, you can see elevation in ALT and AST. and the liver is shown on the right upper hand image on this slide. In bile duct disease, the transportation system of bile outside of the liver, that's carrying bile outside of the liver, is affected. This is medically called cholestatic disease. You can see the biliary tract system on the right lower side of this slide. If you look at this image on the right lower corner, and the small upper green structures, they are the ones that carry bile out of the liver and then join to the duct that carry bile from the gallbladder. Any defect in the system, which could be a stone or narrowing, can cause bile duct disease. In liver tissue disease, we mostly see elevation in liver enzymes, that is ALT and AST elevation on blood tests. And in bile duct disease, we see elevation in alkaline phosphatase and bilirubin. These are the broad categories of liver disease that fall under liver tissue and bile duct disease. As you can see, fat usually only causes liver tissue disease, and other categories can be under both liver tissue and bile duct disease. And they include infections, fat, toxins, inherited or genetic diseases, and cancer. There are several viruses and parasites that affect the liver, but the ones primarily affecting the liver are these 5. They include hepatitis A, hepatitis B, hepatitis C, D, and E. Hepatitis A and E are spread via contaminated food and water, and hepatitis E typically only affects immunocompromised patients. Hepatitis B, C, and D are spread through unprotected sex, intravenous drug use, and blood transfusion. It is also important to note that hepatitis D is very unique and that it can only affect patients who already have hepatitis B infection. It's also important that hepatitis D is the most severe form of viral hepatitis. These are the diseases that affect the liver due to defective immune system, and they include autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. These diseases can have similar presentations such as fatigue, abdominal pain, and itching. And they can also be overlapped with each other and other autoimmune diseases such as inflammatory bowel disease. These are the toxins that can affect the liver adversely. As we all know, alcohol is the number one culprit, and any alcohol consumption more than 14 drinks per week in men or 7 drinks per week in women or more than 4 drinks at a time can affect the liver badly. There are several medications that can affect the liver function. Some are more commonly used medications than the other. For example, Tylenol and amoxicillin are some of these common medications that can affect the liver. So please discuss with your doctor before taking any medication. Excess heavy metal in the liver can also affect the liver badly. There are certain genetic diseases that cause increased deposition of copper and iron in the liver. Furthermore, some of the supplements and alternative medicines can have high content of heavy metal. Please talk to your doctor before taking any over-the-counter supplements. Increased fat deposition in the liver can lead to liver disease, and the risk factors for increased fat in the liver include diabetes mellitus, hypertension, hyperlipidemia, or high cholesterol, and obesity. These are some of the inherited or genetic diseases that affect the liver. They can be Wilson's disease, celiac disease, alpha-1 antitrypsin deficiency, hemochromatosis, and there are several other immunodeficiencies that can affect the liver. I will not go into details into each one of them as that is outside the scope of this presentation. This is another way of explaining what happens in the liver when each function is affected. When the liver tissue is affected, it can be described as the liver is in a bad mood. And we can see that with elevated ALT and AST on blood tests. When the liver is not able to make the proteins it is supposed to, we say the synthetic function is affected. This usually does not happen until 90% of the liver is damaged. This can be described as the liver is unable to do its chores, and we can see low albumin or high INR on blood tests. Albumin is a protein made by liver to help maintain blood pressure, and INR represents the blood clotting proteins made by the liver. When the bile flow or bile outflow from the liver is affected, it can be described as the plumbing being affected, and it can be seen as elevated alkaline phosphatase and bilirubin on blood tests. When the blood flow through the liver is congested, that can be described as having a heavy traffic in the liver. And this can lead to low platelet count and big spleen size. Some of the common symptoms of liver disease include abdominal pain, fatigue, itching, nausea or vomiting, leg swelling, easy bruising, dark urine, clay-colored stool, and jaundice. On this slide, we explore what to expect when you go to the doctor and how does your doctor diagnose liver disease. The doctor will get your history, do a physical exam, and other blood tests. Based on these findings, the doctor will determine if you need further tests, including imaging or other procedures such as ERCP and liver biopsy. While taking the history, it's a very comprehensive process. The doctor goes into details of the present illness, past medical conditions and previous surgeries, alcohol intake, tobacco and other drug use, current and previous medications, including the over-the-counter supplements and herbal products. The doctor will also ask about family history of known liver disease. History taking is followed by physical exam, which includes blood pressure and heart rate measurement, and mostly the physical exam would be focused and pertinent to liver disease. That includes examination of skin, eyes, mouth, nails, and palms. Also, upper chest and back and abdomen, where you feel for any pain, and also enlarged organs, including liver and spleen. The doctor will also examine legs for swelling. After physical exam and history taking, starting with the basic panel of blood work would be the next step. And the basic panel of blood work would include ALT, AST, alkaline phosphatase, total and direct bilirubin, albumin, and INR. Based on these results, the next set of labs would differ. It could be viral hepatitis panel or other tests specific for the autoimmune disease or genetic diseases we already discussed. And these could include ANA, antibodies, or immunoglobulin levels, just to give you a few examples. Following all of those steps, next one would be imaging. Imaging helps us look at the organ closely and non-invasively. There are different modalities available. Ultrasound uses ultrasound waves and can give us details about liver, major blood vessels surrounding the liver, such as portal vein and hepatic vein, also details about gallbladder and spleen. MRI gives more information about the liver and surrounding organs and helps differentiate if a liver mass is cancerous or not. MRCP helps assess the bowel transportation system. CT abdomen involves radiation and is usually done when MRI cannot be done to evaluate certain aspects we already discussed. And as I mentioned, it includes radiation, but also helps evaluate liver and surrounding organs. The next step or the next procedure that the doctor would consider is an ERCP if a bile duct disease is suspected. An ERCP is an endoscopic procedure enabling the doctor to evaluate the bowel transportation system. In some cases, we may have to proceed with getting a sample of the liver tissue to directly evaluate it under the microscope to diagnose or have a better understanding of disease severity. There are different approaches to getting the liver tissue. It could be through the skin or percutaneous measure. Could be transjugular route, where it involves going through a big vein in the neck. It could be laparoscopic approach or intraoperative when the patient is getting another surgery. After a diagnosis is made, how do we manage liver disease? These pictures show different stages of liver disease, the pictures at the bottom. The one on the left shows healthy and happy liver, and the rightmost represents end stage liver disease. When we manage liver disease, we are trying to prevent progression of disease from moving from left to the right end of the pictures or the spectrum. And we also aim to restore some of the function of the liver and help patients move from the right side of the spectrum to the left. That means we really like all our patients to have a liver looking like the red, happy liver seen on the left. To help achieve this, we have a few tools. First is to diagnose the disease, then monitor the disease with blood tests, fibroscan, which is an imaging modality, which I will discuss soon, and also liver biopsy can be helpful. Then comes treatment with medications, or it could be procedures such as ERCP, as we already discussed. In case the patient's disease continues to progress even after management, patients will be evaluated for liver transplant. Here we briefly discuss about FibroScan. It is a specialized machine that uses ultrasound to evaluate liver in different ways to help us determine the severity of the liver disease. It is a quick test done in the doctor's office. Patients required to be fasting for 4 hours prior to the study, and it does not involve radiation exposure. It is also found to be highly reliable and reproducible. The complications of liver disease include cirrhosis or end-stage liver disease, and portal hypertension, which is increased blood pressure in the major blood vessel supplying blood to the liver, also cancer, acute liver failure, and death. So why do patients with chronic liver disease die? It could be from recurrent infections, gastrointestinal bleeding, kidney failure, cancer, or acute liver failure. This slide here shows some of the achievements or improvements in outcome we have achieved in the recent past. The first graph on the left shows the trend in hospitalization in hepatitis C patients in Spain. There has been a 40% drop compared to the early 2000s when patients were treated with interferon. And this was achieved with the use of new anti-hepatitis C medication, also called direct antiviral agents, as a group of medications involved in there. There was a further decrease in hospitalization of hepatitis C patients after a national treatment program was established in Spain, which can be seen at the end of the graph. The second graph, which is on the right, shows the decline in death or need for transplantation, which is the first one. The second one here, also decline in complications from cirrhosis and also liver cancer, which is seen here at the bottom, are the improvements seen in patients with primary biliary cholangitis after treatment with ursodiol. It's also important to note these findings were seen in patients with compensated cirrhosis from primary biliary cholangitis. So they already had end stage or advanced liver disease and showed this progress or this improvement while on ursodiol. These are all remarkable achievements and made possible by the efforts of many people, including patient advocates, patients themselves, patient caregivers, and doctors. We have made huge strides in improving outcomes of these diseases. However, we are not done yet. We still have to work on developing care for many other liver diseases. We also have to work on healthcare access and decreasing healthcare costs, which could also be indirectly brought in by decreasing hospitalizations and increasing affordability of care. Here we will briefly discuss about acute liver failure. A detailed discussion is beyond the scope of this presentation. So acute liver failure is a rare disease compared to chronic liver disease. In acute liver failure, liver shuts down in days or weeks. Most common reasons include toxin exposure or infections, and sometimes the cause of acute liver failure cannot be identified. Treatment of acute liver failure includes identifying the cause and treating the cause. And sometimes patients may not improve with supportive management. In those scenarios, they are evaluated for liver transplant. Talking about liver transplant, we come to this slide, which shows a graph of number of patients listed for liver transplant at the end of each year. The data is from 2006 to 2017. And as you can see, there is a trend downwards, which means the number of patients listed for liver transplant has declined over the years. Even though we have made progress, there are still a big number of patients listed each year, and there are things we can do to prevent liver disease. These are some of the things we can do to protect our liver. Vaccinate for diseases such as hepatitis A and hepatitis B. Follow a healthy diet and exercise regularly, at least 30 minutes for 5 days a week, and educating our patients in avoiding toxins as much as possible, including limiting alcohol consumption and also discussing with your doctor before taking over the counter supplements or herbal products. In summary, liver disease is more common than thought to be. We recommend working closely with your doctor to help diagnose the liver disease, and disease progression can be prevented. Treatment depends on the cause of the liver disease, and we must ask your doctor and be your own advocate. So, with that, I say that if you are a Michelle or you know a Michelle, I hope I've answered some of your questions and alleviated some concerns. Thank you for your attention and participation.